Hi, everyone. Welcome back to another episode of Sexpectations. We are joined today with Elvis from Hudson Pride. So I'm going to give him a moment to introduce himself. This is going to be a really great episode leading into Sexual Assault Awareness Month. So he's going to tell us a little bit about himself and what he does and what his organization is all about. So Elvis.
Thank you so much, Rachel. Good afternoon. My name is Elvis Guiracocha. My pronouns are he and his. I am the Community Health Programs Manager for the Hudson Pride Center. For those of you who are not familiar with Hudson Pride, we're an LGBTQ plus community-based center. We're centralized in Jersey City, but we service all of Hudson County LGBTQ plus residents and also HIV-affected community members as well. So as a nonprofit community center, we offer safe and vibrant spaces for our queer community to thrive and succeed while advocating for their biological, psychological, and social needs as well. My role as Community Health Programs Manager is to oversee our health-related programs. So at Hudson Pride Center, we currently offer free and confidential rapid HIV testing. So regardless of your result, if you test negative, we link you to our prevention program, which we have PrEP counselors that can help navigate different preventative tools to minimize the risk of getting HIV. And if you do test positive through our HIV testing program, we also have a linkage to care coordinator team, which is our client service navigators. And they meet with clients who are recently diagnosed with HIV or have fallen out of HIV care. And with that program, we make sure that we advocate for our clients to make sure that they are not experiencing any barriers when it comes to accessing HIV treatment as soon as possible. A lot of our programs are grant funded. Our health programs specifically have an HIV focus. So the goal is to really minimize the risk of HIV infections by testing more folks. So we're also always doing different community events, teaming up with other nonprofits, other community-based organizations, and also non-traditional settings like libraries, coffee shops. The non-traditional spaces meaning that spaces where you typically wouldn't see HIV testing being offered, but trying to normalize that in the culture and the society that we're living in. In addition to those health programs that I mentioned, we also have a trans health program at Hudson Pride Center, and that's mainly for our transgender community members who are in need of gender affirming care. So although we're not a medical facility, we offer linkages and referrals to our gender affirming care providers. So for individuals who are of the trans experience that need access to hormone replacement therapy, gender affirming therapy, we have a licensed clinical social worker that comes in once a week and provides letters of medical necessity that's needed for insurance purposes to start hormone replacement therapy and access to overall gender affirming care. So that's a little run through and overview of the scope of work that we do at Hudson Pride and my role at the center. We also offer different support groups. We offer support groups for LGBT plus youth, ages 13 to 24. We also offer a group for our transgender non-binary communities. And we also have a support group for our more seasoned population over the age of 50. We call it Rainbow Elders of New Jersey. So a lot of our groups are in person, and every service and group that we offer at Hudson Pride is free of charge.
Wow, that's amazing. We'll be sure to include all of the information about those things and give you the opportunity also towards the end to talk about how people can find you and get involved with all of those things. But clearly we have a really wonderful expert here to be able to talk with us about the specific services offered, and then how it relates to the work we're doing here on campus and how it relates to interpersonal violence and specific kind of marginalized experiences. So I appreciate you being here and sharing all of those resources and your knowledge with us today. So today we're going to be talking a little bit about, like I said, this is going to be our Sexual Assault Awareness Month kind of premiere episode. And it's really important that we took this focus because we do a lot of programming generally about sexual violence. And what became really relevant and important to us was noticing that there are different ways in which people experience interpersonal violence. There's no way to do a kind of one-size-fits-all educational approach or prevention approach. And so in our campus climate surveys, which we have information about on our Instagram, we found that LGBTQ plus survivors on campus are having very different experiences related to interpersonal violence. And because of that, they're also facing barriers in feeling comfortable and having accessible resources. So we kind of wanted to focus specifically on, being a sexual violence survivor within the LGBTQ plus community and how those experiences kind of go together, and then what resources are available to help kind of bring down those barriers and have people feel that there are accessible resources available, and what can we do to be making them more accessible, or more relevant to people who have experienced interpersonal violence and don't know if they're welcome in all of these spaces. And so we have also found, right, people very reasonably have tried to enter some of these anti-violence or prevention spaces, or have tried to benefit from resources, and for a variety of reasons are not met with the same support as other folks. So we'll also be talking about some of those larger, cultural, societal, and policy-based barriers as well. So we got lots of really great stuff. As I was kind of writing these questions, more just kept popping into my head. So I'm really excited to have this conversation. So we'll just kind of start with a broad understanding for people who are listening. In what ways do you see interpersonal violence showing up specifically within the LGBTQ plus community and spaces?
Yeah, and that's a great question to start the dialogue off, I believe, because during my time with Hudson Pride, before I became a manager, I was also working directly with clients for many years. I did the prep counselor role for about 3 years. And one of the things that we always make sure to include in our intakes is, we advocate and try to assess their biopsychosocial needs. And that includes asking questions around abuse, whether that's physical abuse, emotional abuse. And one of the questions that we do ask if they've ever experienced any form of violence, whether that'll be emotional, physical, or intimate partner violence or domestic violence as well. And many, many clients that I've worked with personally through Hudson Pride Center have revealed, their own experiences navigating intimate partner violence. And that can look different in many, many different ways, depending the type of community member we're speaking about and depending the dynamic in which the relationship they find themselves in. So oftentimes they may find themselves ostracized from their own family. So experiencing their own intimate partner violence through the family system. So a lot of times we talk a little bit about like risk factor, we talk about family rejection, social isolation. So these are things that are commonly revealed during intakes through us. And the reason why we ask these questions is to kind of just better understand and assess what the needs are. So we can't expect a client to really reach self-actualization if their basic needs are not met, right? So through that approach, if a client does reveal that to us, we always ask them if they're interested in receiving any services that may help address those issues further. Unfortunately, Hudson Pride, we're not a focused IPV domestic violence center, but we have great partners that we work with throughout the community. So that is a common theme that we continuously do address, specifically when we do intake enrollments for clients enrolling into our programs. And depending on the type of demographic that we're talking about, a lot of times what I see through Hudson Pride, through my own experience, is a lot of Latinx, LGBTQ folks that are experiencing intimate partner violence, not just within their own family system, but also within their own intimate partner relationship, whether that's with their own spouse, their own partner, or even a friend that they may find themselves really close to. That's oftentimes what's also revealed to us when we do ask those questions during intake.
Yeah, absolutely. Thank you for sharing that. And I think it is such a valuable approach, despite not necessarily offering those specific services. Like you said, we kind of operate similarly, where we know that people, in order to kind of thrive in whatever situation they're coming to you for, or whatever they're facing, to be able to figure out those baseline needs is really important. And for those people who are experiencing interpersonal violence or who have had that experience in the past, safety becomes a huge concern. And so for those people and anyone who's experienced a trauma, it's really hard to take additional steps, right? And find potentially stable housing, or attend, medical appointments, or have appropriate health care when your basic needs aren't being met, because then, like, as humans, we have to focus on that, right? Like, we need to make sure we have those things. So I think that that's really valuable to include that in those conversations. And you mentioned as part of it that there are specific risk factors that seem to come up in those intakes, in those conversations that you're having with clients. Could you share maybe specific trends or risk factors that you've seen within the LGBTQ plus community?
Yeah, so certain risk factors as it relates to like a client's own, like for example, if clients are experiencing financial distress, a lot of times that may make them more dependent on their relationship, may impede them to really stick around in those relationships where they might find themselves experiencing IPV and not know it. So a lot of times when the clients do reveal like financial hardship, that's often the theme where it's like, if I leave my partner, where am I going to go after this, right? So it's kind of like trying to help identify those risk factors, providing them services that can help alleviate that, and kind of coming together with the client to formulate a service plan that works best for them. And also, as we talk about LGBT plus community members specifically, like we are often not accepted for our identities within our own personal family system. So oftentimes that does transfold into, the relationships that our clients may find themselves in. And then oftentimes, we do talk a lot about risk factors that influence the disparities that impact our community. But I also think it's important to talk about protective factors, right? What are things that we can do to kind of minimize those risk factors and kind of provide solutions for these issues that we are bringing to light. And I know the Trevor Project, for example, they're really big on data collection, specifically as it relates to LGBT plus youth. And they did a study a couple of years back where they found that acceptance serves as like a primary protective factor specifically for LGBT plus youth in terms of making sure that as long as they have one accepting adult in their lifetime, that minimizes the risk of them experiencing suicide ideation or attempting suicide throughout their lifetime. So I think just taking that statistic and just really influencing the work that we do outside of Hudson Pride, even with Hudson Pride, I think it's important to keep in mind because we can be that one accepting adult in that person's life. And because of that, that serves as a protective factor in terms of the risks that they may find themselves experiencing.
Yeah, and I really appreciate you kind of refocusing that question because I think so many times for people that are part of different marginalized identities or communities, there is a lot of focus on those risk factors or the things that have the potential to cause or bring harm. And a lot of times then we're not focusing on the joy and the resilience that people are able to experience and that we may be able to be a part of that journey. So I do also appreciate you sharing that. And one of the things we talk about as well is that we don't like to necessarily emphasize that physical violence, physical abuse is the only way that people experience or define abusive relationships. And so, like you said, no one sets out to be in these relationships, but if they don't have accepting people in their lives growing up, or they've heard these narratives about themselves, it deeply impacts self-esteem and acceptance. And so then when someone else is violating those boundaries, when someone else is reinforcing that kind of negative self-image that has been created by family members, it oftentimes puts survivors in a situation to kind of keep re-experiencing that pattern. So I do, again, appreciate you saying that we have the opportunity to be that person that helps model, healthy relationships or those protective factors. So yeah, thank you. Our previous episode, we talked a little bit about victim blaming. And that conversation, again, was really important because we found that people experience victim blaming differently, right? That everyone can kind of be targeted by that sentiment just based on the way that we're socialized and our beliefs around sexual violence specifically. But I'm wondering if you see or notice that people within the LGBT plus community are experiencing specific types of victim blaming, or there's these ideas around people that impact them seeking help if they are a survivor, if that makes sense.
Gotcha. Yeah. One thing that I can definitely talk about, just to preface, we know that IPV, domestic violence, doesn't have a gender, right? It can influence and it can impact a lot of folks in many different ways. So I just want to preface with that. And then we talk a lot about victim blaming. At least in my experience, I've noticed that a lot of clients who are open to seeking help and seeking services to help address their situations are oftentimes victim blaming themselves. So like blaming themselves for being in that situation, not knowing any better. So a lot of times we see a lot of like self-shame as it relates to like victim blaming. But then on the contrary, we also see a lot of times kind of like a hesitancy for our community members to actually seek help and to even vocalize that they need help because they have a fear of not being taken serious enough. Oftentimes I can talk a lot about the Latinx LGBT plus community because a lot of these community members are migrating from different parts of the world, different countries, where we talk about domestic violence here, but it looks completely different in other countries. So like Ecuador, for example, it's not even normalized. Domestic violence is only between a man and a woman, right? So we're lucky enough that we live in a country where it's kind of a little more progressive on that end, but depending on which part of the world you're fleeing from, it may look a little different. So, taking their own personal experiences from different parts of the world, and then when they come here, they may be reluctant to even seek help because of the already kind of like the I don't know what the word is, but I'm like a little sucker, but like they have like already like a mindset in mind of how they may be treated because of how they were treated in their own countries when it comes to like issues related to IPV and DB.
Yeah, absolutely. No, I think that you described that perfectly, and it mirrors what we sometimes see is that if survivors have been invalidated in some way before, whether it's about their experience related to IPV or about another part of themselves, whether it's by family, whether it's by, policies, whether it's by those in school or positions of power, that they are then less likely to seek help in the future. Because if you've, had an invalidating experience, I think that really breaks people's trust, especially when we think about how interpersonal violence kind of thrives on that betrayal of trust. So it's already really hard for those who may have experienced trauma to trust, especially then if they've had those people in their lives invalidating their previous experiences. So one of the other things that we found in our campus climate data is that survivors oftentimes disclose to friends before anyone else, before any other campus or local resource. And so it's become really important to help to teach people about how to just like receive and respond to that disclosure, because it increases the survivor's ability to then, if they choose to, seek additional resources if they're met with a more positive response first. So I do think that that is really relevant, and again, unique to, I think, certain people's experiences with victim blaming, right? Because like you said, if a woman decides to report that she has been physically abused by her male partner, like, I don't think that the fear may be as much that she wouldn't be believed. That could absolutely be the case, but there could be other victim blaming things that are a concern for that person, whereas someone in a different situation where that's not the norm might feel that they won't be believed or they won't be taken as seriously. Similarly to that, I have been kind of frustrated with what I'm seeing lately on social media, which I guess is just a trend. Social media can be a great place and also a really scary place. But trends that I'm seeing on social media and language and narratives that are kind of popping up that I think might be influencing, again, people's help-seeking behavior, people's ability to feel confident that they will be believed, that they will be taken seriously. So those are my personal feelings. Those are things that I've seen, but I'm wondering how, if you think at all that social media narratives about, interpersonal violence, and I'm thinking specifically about like grooming, like these narratives about grooming and how that is harming children. Like, I hear those buzzwords and it kind of just drives me crazy how they're being used on social media. So I'm wondering if you feel like those narratives going around on social media are impacting survivors that are within the LGBTQ plus community and seeking help or resources.
Yeah, 100%, because I think words have a very strong power, and when we kind of, speak on issues like this as it relates to our community, it kind of creates a level of stigma that is always prone to our community for many different reasons. So LGBT people are very vulnerable for being stigmatized, discriminated against because of their identity. So when we see social media narratives that kind of, misinterpret the reality of the lived experiences of our community, that does create that level of stigma and can lead to the hesitancy for our community members to even vocalize, them being in the situation that they're in or needing help. I will also say that I think representation does matter. So like on a different end, when we talk about like social media and different like ways in which IPV is being, displayed, we often kind of just see the typical, man and woman, where it's like, IPV looks very different and so diverse. And I feel like not a lot of people know about that. So I definitely think that representation does matter. So when we see films, when we see different documentaries, different things like that, I think that's one step that we can take in the right direction, just to kind of bring awareness to IPV and domestic violence. And the reality is that it can impact all communities, regardless of your gender. So that is something that I definitely did want to know for that.
Yeah, absolutely. Thank you again for bringing that up, because it's so true that when these are already really stigmatized conversations, so to be able to offer people the opportunity to say, like, I haven't had that experience, but I can see a little bit of myself or the life that I've had in what's represented, more than just, again, like the typical representation that we might think about when we hear domestic violence. And it can really change people, even in recognizing, like, oh, I have maybe had this experience before in my life, and I didn't think that like a lot of students will share, like, I didn't think that counted. And so kind of seeing other people and hearing their stories, I think, can have a really big impact. So I want to shift gears just a little bit, because as you mentioned earlier, I think one of the really helpful things to focus on is what we can be doing better, how we can be more inclusive, how we can reduce some of those barriers. So we try to have a lot of conversations about broader social justice issues, not just interpersonal violence, because they are so connected. So I'm wondering how LGBTQ plus specific services, such as counseling, affirming healthcare, housing projects, and like those support groups that you mentioned, like how can those things support survivors and help them find healing in community, even though they might not be specific to interpersonal violence?
Yeah, so I think with topics like this, it also takes a village. It takes a social support system to really help alleviate some of the concerns that many of our clients may experience, whether they're experiencing IPV or not. So for example, like I give examples of some support groups that we do offer in-house, and there's a plethora of other support groups that we don't offer that are definitely needed for our community specifically. So I definitely feel like I'm a very strong advocate for social support systems. Oftentimes, a lot of these community members that are experiencing, IPV or social isolation, are mainly community members that may not have support systems in place. So I think coming together, I think creating space and validating their experiences are one of the most fundamental steps that a person can take towards healing. So even if it's just, taking the initiative to step out of your house, I always use a strengths-based approach when I meet with clients. So oftentimes if clients are coming in and let's say they're experiencing some hardship, or let's say they were just diagnosed with HIV at our center, we always try to use a strengths-based approach, because the immediate reaction is always to be hard on themselves. Like, maybe I should have done this, or maybe I should have came in sooner. And it's like, no, like, let's focus on the strengths now. Like, you woke up this morning, you got out of bed and you made your way to our center. That's a lot of strength right there, and a lot of people don't see that. So that's typically the route and approach that I feel like is definitely needed. Even meeting with, not just with support groups, but meeting with clients individually, using that approach is very, very fundamental towards a person's healing.
Yeah, that's so inspiring to hear, and makes me think about that being kind of a mindset going into Sexual Assault Awareness Month for us, right? Is the courage and the bravery that it takes for people to disclose, or to even go to resources, or to even take that step to ask for help, or to attempt to find that community when maybe they haven't had it before. So kind of shifting our mindset to emphasize those strengths and that kind of bravery definitely has the opportunity to go a long way for people. Along the same lines, I know you mentioned being really passionate about that kind of like community strength and community alliance. What for you would be the biggest cultural or policy shift you'd like to see for maybe the work that you're doing, but also specifically for survivors within the LGBTQ plus community?
Yeah, I would love to see like shelters that are specifically inclusive for LGBTQ plus IPV survivors. Oftentimes we have domestic violence shelters, women and children shelters, but those are mainly catered towards, women and children. So it does create a barrier when we talk about IPV and community members within the LGBT community that are experiencing that. Because it's like, where do they go, right? There's only so many limited resources. So I would love to see, more organizations that come to light, or existing nonprofits that can, include different programmings that are inclusive for our LGBT plus community, and helping them navigate support while experiencing IPV. I would also love to see, normalizing conversations around IPV in our community. As I mentioned before, I feel like there's a preconceived notion that like IPV is only for, heterosexual couples, when it's like, no, like it impacts everyone, regardless of their gender or sexual orientation. So I would love to see more representation, more awareness, and more conversations being brought to light. Like, just being a part of this conversation with you says a lot. So I would love to see different organizations, different higher educational institutions, taking the same initiatives that you are, because it starts somewhere, and it starts here. So that's definitely what I would love to see from a cultural standpoint.
Yeah, and I appreciate you kind of lending your knowledge to this conversation, because like I said earlier, I think it is so valuable, and sometimes the space just needs to be created for people to step into, to take the mic and kind of share their own experiences. And so part of our goal is to kind of just like create that opening for people to like lay that foundation and feel a little bit more comfortable sharing. So I really do appreciate that. And I know that it can also be just really complicated navigating, shelters, especially like you mentioned, that some of them might be inclusive for not just women and children. However, you might not know from the name, you might not know clearly from their website. And even if you are able to find that out, once you're there, what is your experience like? I think that is kind of what separates things when we're talking about like what inclusivity really looks like, is just having people in the space what it means to be inclusive, or is changing their experience to be a more positive one, what it means to be inclusive. So I think that's a really great start to that conversation. And I wish I could, I wish I could kind of change those, especially shelter spaces tomorrow, because one of the big things that we talked about earlier was housing and financial barriers. And so if we're thinking about basic needs, having stable, supportive housing is a really big part of being able to heal from any kind of trauma that you've experienced, or, being able to attend HIV support groups and things like that. Like, the first step is to have a place where you can call your own and feel comfortable, and go through those processes. So I definitely think trying to build that opportunity is something for if you're listening out there to consider. So all that to say, I think you had some really, really great resources that you mentioned in the beginning, and wonderful initiatives that you all are working on. And like I said, I will be sure to include links to those. But if you want to just kind of break down who can benefit from your services, and like how they can find you, how they can get in touch with you, and what the process is, if someone does want to come in and attend a support group or talk to the clinician that comes in.
From our services that we offer at Hudson Pride. So all of our services are catered towards our LGBT plus community, but also HIV affected community as well, because we know that HIV does not just only impact LGBT plus people, it also impacts heterosexual women, women of color, injection drug users. So HIV does not have a face. So we're really open to really providing services for our queer community, but also individuals who are impacted by HIV in some way or form. So individuals who are recently diagnosed with HIV or have fallen out of HIV care, have been living with it for many years, just don't know where to start. We offer those services to be kind of the foundation for these individuals to get the necessary medical treatment that they need as soon as possible. A lot of these support groups are catered towards our community members as well. So anyone who's interested in any services, we offer services as young as ages to 13, and as old as older than 50 years of age. So all of our services are really free of charge and are open to our community members that need it the most. Our mission is to create safe and vibrant spaces for our queer community to not only thrive, but to succeed. So any way that we can help, empower our queer community to get to where they need to be, we're here to serve as that foundation for that. There's a lot that we are working on. We are a community-based organization. We are at the biggest point in time in which where we've been in the past 30 years. So we're located on 3000 John F. Kennedy Boulevard, Suite 306 in Jersey City, New Jersey. And we have a great space there. And we're looking to expand our services to other parts of Hudson County. So there's more news to come. So I think just by giving that little glimpse of what's to come is going to be great for us, because Hudson County is one of the largest counties in New Jersey, and it's one of the most impacted counties when we talk about HIV rates. So that's one of the biggest things that we're working on, just expanding our services. So there's more news to come. So I don't want to spoil anything, but yeah, and that's one of the biggest things that we are definitely doing. And anyone who's interested in getting in touch with us, definitely follow us on Instagram, Hudson Pride Center. Also our website, join our email chain list. We throw a bunch of events throughout the year centered around sexual health education and different workshops around meditation, affirmations, and also just normalizing HIV testing where we can. So we do like paint and sips, or we do like health fairs. We also do like different movie screenings, like different ways that we can really engage our target audience and provide these resources directly where they're at is the approach that we like to take. So we also encourage individuals from our community to reach out to us if there's ever any specific event or specific thing that our queer community wants to see in our community. We're more than welcome to hear that feedback, and even allow community members to kind of take initiatives through Hudson Pride Center. That's definitely something that we would love from our community. And I'm the community health programs manager, so I help oversee all these programs, and we are expanding as the years go by. So I'm really privileged just to be in the position that I'm in. I started off at Rutgers, Newark, did my undergrad there. Then I went on for my master's through Rutgers, New Brunswick. So I've really been able to utilize my knowledge. I specifically minored in women and gender studies and LGBTQ studies throughout my undergrad and graduate degree. So a lot of that knowledge has been influencing the work that I set forth with the Pride Center. So I'm always open to learning more. I think continuing education is key when we talk about LGBTQ related topics. And I always say this because the topics we're touching on now may differ 10 years from now. So, and vice versa, things that we learned 10 years ago don't apply now. So it's ever evolving. So I do encourage everyone just to do your due diligence, continue education, continue to educate yourself. And it's okay to, ask for help, ask, for more information. So my email is Elvis, ELVIS, hudsonpride.org. If anyone ever wants to reach out to me to connect, I'm more than happy to touch base with you.
Thank you so much for sharing all of that great stuff. And not only are you trustworthy just as a Rutgers Newark alumni, but in having conversations with you and some of the other staff, I can really get the sense that it is such like a grassroots community-based organization in every sense of those words. And you take that very seriously. So I am also, honored and privileged to have been able to have this discussion with you and to have gained another resource that we can share with students. And it also sounds like you have a lot of really fun stuff going on, which I think is always really cool, like you said, to establish that sense of community. I think since coming out of COVID and trying to find ourselves and what we want to be a part of can be a difficult process. So I am also grateful that you shared all of those really exciting ways to be involved as well. And you've left us a little cliffhanger, so be sure to follow their Instagram so that you can see what's coming up for Hudson Pride. But thank you again, Elvis. I really, really appreciate you speaking with me today.
Thank you. You too, Rachel. It was a pleasure. Thank you so much.
Hi, everyone. Welcome back to another episode of Sexpectations. We are joined today with Elvis from Hudson Pride. So I'm going to give him a moment